Physio's YouTube channel. In the previous video, we talked about what is sciatica and its causes and symptoms. And also we covered about how long the sciatica lasts. If you haven't watched those videos, you can watch those videos in the link which is given in the description below. Alright, let's get back to here. In this video, we are going to talk about how to differentiate the regular low back pain and sciatica. So basically, sciatica and the lower back pain are two different conditions that are often confused due to the similarities in their symptoms. It's important to know the major difference between these two conditions and to understand how they may be related to each other. The following comparison of sciatica versus low back pain. So first we can go to sciatica. Sciatica is an umbrella term which can be described and the number of different conditions with the different cases. Generally, sciatica involves a pain that shoots or radiates down back the leg until foot and toes. The pain may be a result of the problem with a large sciatic nerve that travels from the buttocks to down the leg. The pain that travels down the leg in this way is always generated by the sciatic nerve. The structure, such as spinal joints and the lumbar disc, can also cause the pain to travel down the leg. This also often referred to as the sciatica, even though the sciatic nerve is not a fault for the causing of the pain. Lower back pain is often coincides with a sciatic pain. When the pain does not shoot down the leg, often it radiates to the buttocks, till the buttocks. This is where some people may be unsure on what type of pain to differentiate, either the lower back pain or the sciatica. Moreover, the lower back pain is usually experienced near the belt line in the pain, maybe in the middle or of the one side of the back. The type of pain ranges from dull, stiff ache to stabbing pain that makes any movement very difficult. Then there is almost an endless list on what may cause a low back pain. The low back pain is commonly produced pain includes joint disc, muscle and kidneys. The back pain very often occurs in the people. There is no obvious change in any above the structures. The common triggers for the back pain include unconsumed physical, not much physical activity, lifting with a poor technique, stressing, your sickness of menstruation, and awkward sleeping position. There are lots of things, but these are the major cause for the lower back pain. For some, onset back pain comes after the body has taken a pounding through sickness, through stress. Sciatica often has a quick sudden onset, and unlike some forms of low back pain, it's often easier to pinpoint what caused and when it began. Sciatic pain, particularly pain in which radiates all the way the foot long with a symptom of numbness, tingling or pins and needles should not be ignored, particularly if the symptom persists for a long time. There where a professional options really matters, and it's the best interest your long-term health. An episode of sciatica or back pain prevents you from controlling your bladder or opening your bowels. You should seek your physician or a doctor as soon as possible. The low back pain will often resolve by itself, or usually it takes up to 6 weeks where it persists. There are many forms of treating available to help. The physiotherapist use a combination of hand-on treatment and exercise to settle the pain gradually to restore the movement and the functions of the low back pain. But sciatica, there are lots of cases, will take a longer time to resolve than the common lower back pain. Very often, the full-time recovery might take up to 3 to 6 months. It depends on the intensity of the pain. The most important starting point is through clinical examining and then establish the cause of the problem. Then previous mentioned, the pain may not be always truly sciatic in nature. So the pain only radiates to the knee. The most effective treatment for this condition often involves the combination of choices. Modern medical management of sciatica can be very effective in the combination with the physiotherapy and advice on what to do and what to avoid recovery can happen sooner than the later. Hope you all have a general idea about by differentiating the regular lower back pain and the sciatic pain. So if you experience any of those lower back pain or sciatic pain, please contact us in the number which is given below. Thank you for watching the video. Hope you all have a good day. Please do considering like, share and subscribe. Thank you.